Hello, this is Dr. Wells from Wells Medicine, and I wanted to talk about the process of coming in for ketamine treatments and how to sign up for a first infusion and what the whole process might feel like. So, a lot of patients will wonder whether or not they need a referral or whether they need to come in for a consultation before treatment. When a patient wants to book for a ketamine treatment, usually they have a long history of diagnosis and treatment from other providers, whether it's a therapist, a counselor, a psychiatrist, a psychologist. So we don't need a consultation for ketamine treatment separately. We talk briefly before the first ketamine treatment and we'll discuss any diagnosis that you have and any prior treatment at that time. Um, we don't need a referral from any particular physician or counselor, although we're always happy to have one. And we're happy to be able to contact your providers if you would like. We do require that patients have a provider of some kind that they're able to go back to if they need any assistance or help outside of ketamine infusion. So having a primary care doctor or a psychiatrist, psychologist, someone who's aware of your condition and has treated you in the past for it is really helpful. And we do require that you list one of those on your paperwork. When patients decide to make an appointment with Wells Medicine, it's best if they call the office and talk with our front desk people, get any questions answered, and schedule your first few appointments at that time. You can make appointments through our online scheduling system, but we'll have one of our front desk people call you as well, just to go over the things that are very important for your first appointment, to bring a blanket, an eye mask, some music, and to not eat or drink beforehand. When you do sign up for an appointment, we'll send you a new patient packet. And we'll ask that you fill that out and send that back to us before your first appointment. It really helps us get to know you and see if there are any things that we might want to talk to you about before your first treatment. When you come in for your first treatment, you'll meet with the front desk people and pay with a cash or credit card at that time and fill out some more paperwork, a consent for treatment, and a quick inventory of depressive symptomatology questionnaire. And then we'll bring you back for treatment and have a discussion about your new patient paperwork and any treatment history, any medications you're on and allergies, and any prior experience that you may have had with psychedelics or drugs of abuse or other medications or anesthetics. And then we'll insert a small IV. We use the smallest gauge IV available, and we'll start the ketamine infusion. We'll help you get your music started and turn your phone on Do Not Disturb and get set up with a blanket and an eye mask if you want it, or dim the lights in the room. And everyone has a doorbell in case they want to reach me when I'm not in the room. If you'd like to bring a friend or a family member to sit with you during your infusion, that's perfectly fine too. And that friend or family member can come in only for the infusion, or they can be with us as well while we're discussing things before the infusion. The infusion lasts 40 minutes. And then afterwards, we'll discontinue the IV and you'll sit with us for about another 15 to 20 minutes, just resting and relaxing and letting the effects of the ketamine diminish. Once the ketamine has worn off with the floaty effects and you're feeling a little bit more sturdy and stable, then you can take an Uber or have your driver take you home. Some of the side effects of ketamine can include a headache, sometimes a little bit of nausea. Those should all be gone by the time that you leave from our office within 15 or 20 minutes after the infusion is done. So to summarize, you don't need a referral. We do ask that you fill out your new patient paperwork ahead of time. Before your first infusion, you will most likely have to talk with one of our front desk people, either when you're signing up for the first infusion or after you've signed up, as they call you to discuss some things that are needed to bring in for your first infusion and to discuss any questions that you might have. And for your first infusion, we'll have a sit-down consultation before the treatment starts to go over any questions that you have at that time.